So my name is Andres Viana, and I am a board-certified clinical child and adolescent psychologist and a professor in the Department of Psychological and Brain Sciences. So back-to-school anxiety is a pretty normal reaction. You know, starting school, a new year for kids can be anxiety-provoking. New classrooms, new teachers, new schedules. All of that can generate some temporary anxiety. So that is normal. Most of it will dissipate over the first few weeks once children start to develop some familiarity with the classroom, the teachers, sort of the routine. So what we want to, as parents, is to sort of look out for any persistence in the anxiety, any intense reactions, and whether the anxiety kind of becomes chronic over the school year. That may be some reason for concern. The other important thing to think about is anxiety can look differently depending on the age of the child. Sort of there are developmental changes. So young children may worry a great deal about separation from caregivers, about meeting the new teacher, safety concerns in the school, concerns about the new building, and so on. Older children in middle school and high school may worry more about peer relationships, their appearance, academic concerns, their grades, their extracurricular activities, social media worries, and the like. So it may look a little bit different depending on the age of the child. Back to school anxiety can be temporary, right? But we want to look for whether the anxiety persists over time or whether the child, reacts intensely to the return of school. And the other thing to be sort of looking for is that children may exhibit anxiety through behavior. So rather than saying, Mom, Dad, I'm anxious, they may actually exhibit sort of behavioral signs that signal anxiety, right? So for instance, they may have emotional outbursts, they may show clinginess to caregivers, they may show sleep difficulties, and kind of overall kind of behavioral changes as well. Anxiety can also manifest somatically, right? So in terms of physical symptoms for kids, so some children will, and adolescents as well, will complain about headaches, stomach aches, nausea, diarrhea, again, changes in sleep and appetite. And if these changes tend to kind of coincide with the beginning of school, let's say Sunday night, or the morning of school, it may be anxiety related. If those symptoms then again tend to dissipate or improve once the child is out of school, like at the end of the day or over the weekend, then it may be an indication that anxiety may be a cause. So there are kind of key developmental transitions that can increase vulnerability for anxiety. So for instance, the beginning of kindergarten or first grade, the transition to middle school, the transition to high school, moving to a new city or changing schools. So those are periods where we typically see children exhibit an increase in anxiety, and that's not necessarily pathological or problematic. But again, we want to be looking at whether that anxiety persists over the course of the school year, or it starts to really interfere with the child's daily life, friendships, family life, the ability to engage in hobbies and extracurricular activities. The goal here is not to avoid all anxiety, right? Or to extinguish all anxiety. We all experience anxiety at one point or another, right? Almost all kids will experience some degree of anxiety about returning to school. So the goal is not to eliminate that completely, but again, rather to show that we can do difficult things, right? Even when we are experiencing some degree of discomfort, right? So that should be the message. How do we do that? We focus on what the child can do and can control, right? So instead of, again, providing lots of reassurance, we can have a discussion about Yes, it is sometimes difficult, right? And a little bit anxiety provoking to be going into a new building or meeting new teachers. What can we do about it, right? What can we control? What is something that you can do to lower that anxiety so that, again, you're not communicating a message of avoidance, but rather a message of coping and being proactive about those emotions. Leaving home and starting college away from family and your support system can be very anxiety provoking. And in fact, we see significant spikes in the transition to college in terms of anxiety. One of the things that students can do, obviously, is to be proactive about it, right? So colleges these days have excellent resources, mental health resources, that students can access on campus, usually at no cost to the student. If anxiety, again, starts to interfere and it's so severe that it starts to impact your grades or your ability to attend classes or to really connect with other students, that might be a sign that maybe some support is needed. Some degree of anxiety during the first month is expected, right? That this is a big transition and a big change for many, many kids. And at the same time that anxiety is something that can be overcome, right? And that being brave in how we approach these challenges, right, as opposed to avoiding situations that makes us uncomfortable, is really the right way to go, right? We have known this for many, many years now of clinical research, that the best thing to do is not to avoid those things that would cause discomfort, but to actually face them, right? And there are many, many different skills that we can teach kids and students in general on how to do that.